Hey learners, today we will see how we can do the IV cannulization. So these are the articles which we are needing for doing the IV cannulization, and before going to the IV cannulization we should always check for the contraindication with the patient, like if patient is on dialysis, because dialysis patient have the fistula and we can give the medications through that fistula. Okay, so we don't have to do another prick to the patient. And another contraindications are like infection, phlebitis, IV infiltration, burn, traumatic injury, DVT, that is deep vein thrombosis, coagulopathy, increased level of the APTT INR. All these are the contraindication. We don't have to do the IV cannulization in these patients. Okay, next is the steps of the IV cannulization. So first of all we have to wear the gloves, that should be sterile gloves, because it's a invasive procedure and we are going to do phlebotomy. And the second thing, we have to prevent the cross infection to the patient as well as to the caregiver, so we have to wear the sterile gloves. Then after that we have to assess the area where we want to do the IV cannulization and tie the tourniquet to the selected area. Basically tourniquet do two things. First, it stops the blood flow and makes the vein palpable and prominent and visual to the naked eye. Then second is the vein will not slip or move while inserting the IV cannula. In some of the patient, veins moves too much, so that it will make difficult to insert that IV cannula in the vein. Okay, so it will prevent all that. After that we can also use the tapping method to select the area for IV cannulization. After that we have to clean the selected area with the alcohol swab or the soaked isopropyl cotton swab to visualize the area of inserting the cannula. Okay, then insert the cannula, IV cannula, in 15-degree angle or the 45-degree angle to the selected vein. As my friend is using the 15-degree angle to insert the IV cannula, so she what she does, she slightly pull upward and proceed toward the straight to the vein, so that the needle will not puncture the vein or the medication will not infiltrate to the outer of the vein area. Okay, so this cannula, automatic cannula which we are using, and it doesn't need to do any capping or and it automatically closes its port. Okay, so after that we have to flush the cannula with the normal saline, or we can use the phosphorus if you have, to see or to check the veins patency. Okay, and to check the infiltration, pain, bulginess in the vein. Then this cannula with the this cannula is fixed with the easy fix, or you can use the micropore or the gauze piece or gauze bandages to fix this cannula. And then write date of cannulization and stick to the easy fix, so that to assess and to check whether it is needed to change this IV cannula or not. Okay, next step is you can also add Triway or Q site to increase the port of the medication, and at a time you can give 2 or 3 medications. Okay, so after doing all this procedure, discard the waste according to the biomedical waste management, and that's it, your IV cannulization procedure is done. So hope you understand how to do IV cannulization, and thanks for watching. And if you like the video, please like, share and subscribe the channel.